Good afternoon, everyone. Thank you for joining us for today's webinar, and welcome to the start of August in the month where we celebrate women's multiple contributions. So I'm Rushan Khalfan, a professor of occupational therapy at UCT, and I'll be your moderator for today's conversation with our all-women group of panelists. So with me today is Dr. Marlene Leroux, Professor Harsha Cathard, and Ms. Charlotte McLean-Schlappo. The way this conversation is going to work is that we will begin with a short input from Charlotte, who unfortunately has to leave us early to attend to an unforeseen matter and so can't stay for the full webinar. And then after Charlotte's input, we'll have input from Harsha and Marlene. But during the conversations or during the presentations, I invite you to post your questions in the question and answer box. And as you listen to the panelists, to jot down those questions and we'll respond to them later in the discussion. So without further ado, our first panelist is Charlotte McLean-Schlappo, as I said, and Charlotte is the Global Disability Advisor for the World Bank Group. She has vast experience as a respected human rights lawyer in disability rights and advocacy, and has also included her experience has also included leading the USAID's work on disability inclusive development and working as a senior operations officer at the World Bank in the East Asia Pacific and Africa regions. Charlotte has also worked as a commissioner here in South Africa for the South Africa Human Rights Commission and worked for UNICEF on child protection. Charlotte is very well known as a human rights lawyer. So in today's panel, we're centering our conversation on disability inclusion, and we discuss how the current and future realities at this time of COVID-19 really is affecting persons with disabilities' lives. So our panelists will contextualize and illustrate what it means to be reset for inclusive practices in times of COVID-19. So Charlotte, to start with you, many have spoken about the tensions between economic livelihoods and the ongoing social inequalities. So as we think about the current realities from a global and intergovernmental perspective, what more would you say needs to be done to reset for disability inclusion? Charlotte, over to you.
So thank you very much, Roshan, for the opportunity. And again, my sincere apologies for having to end earlier than I had expected. It's absolutely fantastic to be part of an all-women panel in the month of August. So this really is exciting. And then, of course, to address a very important issue. So, I mean, I just want to set a bit of context and start off by saying that, you know, at the beginning of April in 2020, the COVID-19 had infected over 1 million people in 204 countries and territories across the world. And we knew already then that the pandemic's disruption of economic activity was unprecedented in this century. We now know that those numbers have grown exponentially. What we also know is that the pandemic is leaving millions of workers unemployed. We're seeing the collapse of trade and investments, and we've seen the collapse of financial markets in many parts of the world. In addition, we're seeing that countries that have existing humanitarian crises are particularly vulnerable and therefore are less equipped to address the pandemic. Now, we're also seeing that humanitarian needs may also occur in other countries as a result of the excess pressure on the healthcare system. And so I think it's important to think about that. And then I think another important piece is the overall delivery of essential services has been completely disrupted by way of the pandemic. And this has secondary effects on employment. We're also seeing that the economy and issues related to mobility are being stymied. And we're seeing a flare up in many countries around the rule of law. We're seeing issues around the protection of human rights. And increasingly, we're witnessing social discontent and unrest in many countries across the globe. Now, what we're seeing at the World Bank and at the UN is that there's emerging evidence that indicates that persons with disabilities are disproportionately impacted by all of these disruptions. So the disruption on health, the disruption on social mobility and social activities, and certainly the economic impacts that Roshan spoke about. We know that the impact of this pandemic is heterogeneous, and it really depends on the region, it depends on the country context, it even depends on the sector and goes further down to various activities. And as I mentioned earlier, and I don't want to lose sight of this, is that it further exacerbates humanitarian contexts, where persons with disabilities are already facing obstacles such as access to water, sanitation, hygiene facilities, which are all essential in preventing COVID-19 infections. It's also important to just mention the issue around school closures, right? So we know that across the globe, schools have been closed. And the concern here is that children with disabilities have been part of that. However, many of those children are not receiving education in an accessible manner. So the online education systems is not working for that cohort of children. So that's a concern, what's happening now. And we just finalized a report at the bank that goes into some great detail on that, and I'd be happy to share that. In addition, there are also concerns that have been raised as to whether when schools reopen, whether children with disabilities will be able to go back to school. And there are a whole host of circumstances that indicate that they may not be able to go back to school. So with that in mind, we have to be very deliberate in taking concrete steps to ensure that the reopening of schools for children is in fact that reset moment, and or ensure that if we have to continue with online learning, that it is accessible and inclusive for all. Now, I just want to spend a minute talking about the funding and the financing for COVID-19 responses broadly, but also as it relates to disability. So we've seen, certainly from the perspective of the World Bank, that the funding responses have been quite swift, right? So a lot of resources has been earmarked for COVID-19 responses. However, many of these responses remain constrained by lack of information. I mean, there's so much that we don't know about this pandemic, and a lot of what we're doing is kind of learning on the job, so to speak. So there's a lack of information. The other constraint is that we now have serious restrictions in terms of field work, right? So there's, the way we do development has changed. You can't have teams on the ground because teams are now unable to be on the ground. And so that is a further complication. And then, of course, the overwhelming severity of the crisis really has impacted the way the funds are moving. That said, I also want to point out, and this for me is an issue of concern, is that there's a prediction of reduced GDP. And what that will mean from a financing point of view is that this may very well diminish ODA. And what that will look like is that it will be a pivot to repurposing the bulk of the overall funding for COVID-19 programming, which of course is important, but it can't be an entire pivot removing or reducing the funding available for regular disability projects, all towards the COVID-19 programming. And so some level of balance needs to be maintained in that regard. Now, just to state the obvious, we are talking about persons with disabilities here, and we recognize that they do not make up a homogeneous group. Neither do they, and in addition to that, there are a lot of intersecting factors that comes with disability, right? So a person can be disabled and have a different gender, age, sexual orientation, ethnicity, and all of these issues are really important because they speak to aspects around compounded discrimination. And this plays itself out in public health responses, like within the pandemic, and it further deteriorates social and economic resilience in these types of pandemics and humanitarian contexts. I think it's also important that we should note that if we're to look at lessons learned from other pandemics, say for instance the Ebola crisis, we found that there were very few normative lessons learned, right? And this was because people were not doing research, not capturing the data on persons with disabilities. And so what we've tried to do in the midst of this pandemic is to be very deliberate about collecting data, doing the research, gathering the lived experience, and make sure that we can document this to enable ourselves to address the programming around it. Now, I want to leave you with a couple of key messages that are emerging from the work that I'm doing at a global level on the issue of COVID-19 and persons with disabilities. And I sit on the Undersecretary General's task force on COVID-19 and have a focus on the funding aspects of that and persons with disabilities. So these are a couple of reflections that I'd like to share that come from these discussions. One is that the information about COVID-19 risk and prevention may not reach persons with disabilities, right? And therefore, when we think about messaging, when we think about public service announcements, we need to insist that these are produced in an accessible format. So that's an important message going forward. Information needs to be accessible and readily available to persons with disabilities, given their heterogeneity. We also need to address current challenges that will require commitment and creativity. I think there are no quick fixes to addressing this pandemic. We need to think about what we have to do for the long term. And in so doing, we need to carve out deliberate spaces to engage persons with disabilities themselves as actors to the response. And this is really important. It's about ensuring that we engage the organizations of persons with disabilities, and that we recognize their mutual exchange of expertise, but in addition, work with those groups to build their own capacity so that they can participate and engage in a meaningful way. Another key action or message is to ensure that our responses to COVID-19 are inclusive, and that we collect and use data that is disaggregated by disability. We have to do a better job on collecting disaggregated data, because this then influences how we spend and the allocation of resources as programming rolls out. We also need to have a better understanding, and therefore I'm very grateful for this session today, on how persons with disabilities themselves are impacted by COVID-19, right? So the differentiated impact of COVID-19 on this population is important to understand. And I think in doing that, we need to think specifically about challenges faced by women and girls with disabilities. So we know from the data that there's been increased rates of gender-based violence during lockdowns across the world. And so we need to think about, what does this mean? How is it different? And how can we understand the granularity of that for women and girls with disabilities? So that remains an important piece of research and work that needs to go forward. And then I think it's essential that the inclusion of persons with disabilities in the COVID-19 response be considered throughout all the stages of the response cycle, right? So starting off with needs assessment, but just insisting that at every point in time, there's check-ins to see where are we in terms of disability inclusion. I want to close by saying that, you know, in the recent years, we've definitely seen significant momentum on the inclusion of persons with disabilities in development and also in the context of humanitarian action. And I think it's fair to say that we've seen a global momentum, right? And that it's beginning to bear fruit, and we're beginning to see this translated into change on the ground. However, if we're not deliberate and vigilant about insisting that disability be included, or disability inclusion be a central part of all COVID-19 responses, I fear that many of these gains will be reduced. So we need to pay attention to the gains made and make sure that none of those gains are reduced in any way. And finally, I'll close by saying that disability inclusive strategies absolutely must be embedded in any form of building back better. So any kind of recovery that we're looking at has to have a component that speaks specifically to disability inclusion. And with that, I will thank you and hand back over to Roshan. Thank you.
Thank you, Charlotte, for those powerful insights and really scoping out, the intersectoral and also intersectional issues that we need to look at in terms of being, as you said, deliberate about including disability and paying attention to the gains made so that we build back better. Thank you also for joining us. We're sorry that you have to leave, but understand the competing commitments. So we wish you well in the deliberations that you now have to go and be involved in. Thank you. Thanks, Charlotte. Okay, so our next two panelists are Marlene and then Harsha. So Marlene Leroux is the current Chief Executive Officer at Artscape and is well known for her passion in using arts and culture as mechanisms for empowerment. Marlene obtained a Master's of Philosophy in Disability Studies from UCT and was also awarded an honorary doctorate in education from the Cape Peninsula University of Technology. She's also the recipient of numerous awards, recognizing her contribution to promoting disability rights. Then Professor Harsha Cathard is based here at the University of Cape Town and co-leads Inclusive Practices Africa, which has a transdisciplinary project that focuses on disability inclusive practices. She teaches on the Disability Studies program and is an NRF-rated scientist who conducts research into disability inclusion in education, economic and health systems. So we'll start with Marlene. And Marlene, I'd like to ask you, from your knowledge and experience in South Africa, what has become most apparent about how people with disabilities are considered during COVID-19? We've heard from Charlotte about the importance of disaggregating data and understanding the experience of persons with experiences of persons with disabilities. So if you could perhaps tell us a little bit more about that from your view.
I just want to say thank you for the opportunity that we could share on this very important subject, because we're talking about humanity and that all lives matters. And this is where persons with disability comes in. Of being a field worker, I also just want to say I've suffered polio and I'm a person with a disability, and I had a child with a disability who had cerebral palsy who passed on 3 years ago. So it is, I've experienced disability on all levels as well, and as being a rural woman myself, being disabled from a very, very young age from a rural perspective. I think what is most important is that during COVID, it really reveals the inequalities that existed in our health system. And we, as South Africa, I can say we have a lot of data and we have wonderful researchers, knowledgeable persons, and we have policies. It's the implementation thereof. We have universities, professors, and we have one that is here, and we have Charlotte that just so eloquently expressed what has been done. When the pandemic has been came to South Africa, as per se, the first thing the president announced it, but one of the things that he didn't, one of the aspects he didn't announce is that persons with disabilities, what are we going to do for you? Immediately, I have written to him very clearly and stated very clearly, for a person with a disability to go into isolation, self-isolation, without care, without caregivers, you can sign off by saying that person is going to die. Secondly, access to basic things. As you know, our society is already inequality is existing before COVID-19. It is even just more because persons with disability have no access most of the time to economic equality. It's very important that we need to talk about equity and equality. You can talk about equality, but if you don't talk about having the resources, which is equity, you're going to face what we're facing now, that disability is just going to be not on the radar. So what I've experienced just before COVID was announced in South Africa, I visited a group in Heidelberg, and that was specifically the stroke patients in Heidelberg, because I want this conversation also to be a real conversation as well. And this particular, and this is a group that really works in all the Heidelberg section, in the informal settlements all over, and occupational therapists that is so needed in our communities. And I've done a session with them, and then COVID happened. It was already a poor community. Then they couldn't get access to food, basic food, basic transport was a how to clinic, even if the clinic is open. Secondly, is that how am I be protected? Because if you're wheelchair bound, people didn't think about when they do the essential list that your wheels have contact on the ground. So you need to look at gloves. Everybody just spoke about having masks, but what a person with a disability, the essential list didn't come through. Then we've asked also for a hotline. For instance, just persons with disabilities are not blind. A vast spectrum that we need to look at. We've asked for a specific hotline so that persons with disabilities can then, or parents who have children with disability, can call in to give guidance what is the needs on the ground. The third aspect that I've spoken about was that we're talking about women and girls. Sanitation pads. No one thought about that in this particular package. We all just thought about food packaging. What about that young girl, rural girl that's without sanitation pads? So all of these things was not really thought through in a sense. But what was more alarming, where I was sitting and working on the ground specifically, is that there were NGOs that could have helped government and could have given a lifeline out of the COVID budget to say, there's the data, here's our list of NGOs that is already working on the ground. Let's capacitate these NGOs more in order for us to render a service on the ground. Government should be looking at monitoring and evaluation and not as implementers. I think civil society wants to assist. That's my first thing that I would like to contribute. Secondly, also parents with children with disabilities. What type of support are there for them in this particular COVID-19? What kind of support do we need? We didn't make that particular list. We all just talk about policies that needs to be implemented. The policies should be implemented by the parents, but the resources should be given to the parents. The third aspect that we asked for was specifically, and what I've seen was the transport that was really not available for persons with disability. The fourth aspect I would like to highlight before Professor Asha comes in is the schooling as per se. I want to link it to tertiary as well, is that all policies, before we write that policy, we should put a young girl, rural, very poor, that has no access to resources in the middle of before we're writing the policy, in order to see whether that young girl life will be made a different and whether that policy can be implementable on the ground in order to service. If we can't service that young girl with a disability in the most remote area, then that policy is up for failure. And that should be our stance that we need to look at. When we come to the schooling system and the special needs schools as per se is not just about the curriculum. It is also about where services is rendered by physio, medical services, socialization with other children and young adults as per se. And it's important, and also food access, medicine, access to medicine. The schooling system has been closed. The child needs to go back where we know in a shack situation, have no access. The family doesn't have access. Even if you get a grant, the grant in its per se never ever can really foresee, because that grant most of the time feeds so many people. And that is why even the up of the grant has not really can foresee in the assistive devices that the learner needs. That needs to be linked to when I'm talking now to the university as per se. When we go to higher learning education, there is disability units, but the disability units, do we have that particular data to say, is those particular tools that these persons with disabilities, especially students with disability, do they have the real access to be online? Do we service young adults at university correctly with the tools that they can have equal education? So my plea is that equality must go with equity and social justice. So for me, on the ground, at the moment, we're trying to look at task teams, which are not working because the task teams are now being absorbed in the Ministry of Youth, Children, and Persons with Disabilities. And we need to, after and during this pandemic, we need to do a real evaluation by saying, is this currently working? What is the lessons that we learn from this? But also, what are we currently doing with this particular response?
Thank you, Marlene. I think you've really given us a view of what the difficulties around implementation are. And I look forward to returning to some of the issues that you've raised around how to center disability inclusion in the discussion that we'll have. But I'd like to first pass over to you, Harsha, so that you can do the presentation.
Thank you, Roshan. Thank you, Marlene and Charlotte. I guess for joining the conversation at this point, it would be useful to just look at some stats and stories around what's happened in this COVID-19 pandemic. Now, for everybody that's listening, the numbers that matter to you, try and remember them. So if we firstly look at the global estimate of prevalence of disability, it is estimated at 15% of the population. For South Africa, we don't have consensus on disability prevalence, but there are estimates that it ranges from 7.5% to 15%. So it means that at least 4.5 million persons with disability live in South Africa. Across the world, we have 1 billion people, and in Africa, 300 million people. So if we are thinking about disability inclusion, we can see the scope and scale of the challenge that faces us. And what COVID-19 has done is made this much more apparent. Now, what really caught my attention in this time was, of course, the gross inequalities that Charlotte and Marlene have highlighted. I Can't Breathe has become synonymous with the pandemic, from George Floyd, who was brutally murdered by a policeman, to millions of people with COVID-19 who are struggling to breathe every day. This pandemic has really stopped us to think about whose lives matter, and importantly for us in South Africa, that Black lives matter. In South Africa, the majority of persons with disability are Black people living in poor conditions who struggle to be included in health, in education, and the economy. So while we've made progress, there is still a lot more to do. And it is very heartening that there are very good examples of inclusive practices through community programs, all of which has become visible, but in many ways in the COVID pandemic had to stop. Now, these are the programs that really empower people in communities. And as Marlene has said, that these need to continue, they need to be strengthened so that people in rural areas, people who have little access to economy and health systems are included in the support that is provided. The other point that Charlotte raised, which is really, really important for us to consider, is the gender-based violence against women with disability. And we know from the figures before COVID-19 that women with disability are 10 times more likely to face gender-based violence than women without disability. And I think this is a silent pandemic that is going to last much longer than COVID will. And all of the actions that are taken around gender-based violence programs therefore must be disability inclusive. Now, in this time, there were many different stories that, came to our attention. And I guess the stories really speak to the complexity of the problems. It speaks to the actions that people take and the agency that there is to change what is currently happening. So Leanne, who's a dear friend of mine, shared a story with me about her son Luke, who has autism. Luke is 7 years old. He has become very agitated during lockdown. He does well with structure and routine provided in schools. The sudden change in routine was traumatizing for him. He would get up at night crying and demanding attention. He began to regress. All the gains he'd made while he was at school was getting lost. He used to bite me, she said. Biting had started again and then got even worse. He started self-harming and biting himself. This was unbearable for us. We contacted everyone we knew. Some advocated for schools to open, whereas other parents didn't feel that this was safe. I personally was very grateful when schools opened. Within days, he was settled again. He's doing very well now, even starting to say words. There is no one size fits all. We all had so much support. People gave us food, nappies, emotional support. But I hate to think about what happens when people don't have these supports. What her story highlights is the need for very early support of every child with disability, every child and their families. Early childhood development is foundational for basic education as well as long-term livelihoods and employment. So all of the actions that we take now must really reinforce actions that we've previously put in place and ensure that we build on these. The other story that I heard was in a discussion with a friend who works in state subsidized housing. Now he became aware of 9 disabled people who did not have access to housing. On investigating this problem, he found that they didn't have medical assessments, which was necessary for their housing application. In a COVID-19 context, this situation is even more challenging. People don't have easy access to safe transport to get to a medical assessment. And typically, if you are a person on a wheelchair or you have an assistant, then you must pay double for your transport. And so he decided to take action and began contacting the relevant authorities arranging transport so that the assessments could be done for a housing application. But I guess what we've learned from this is that there must be coordination between departments of health, labor, social development, transport, and importantly, political will of people across the different systems to effect this change. What has come to light is that livelihoods and earnings of people are of great concern to persons with disability. So while we have health needs and housing needs, we equally have a great concern about what is going to happen in COVID-19 as people have lost jobs and access to the economy. But I guess for us, the question is about what are we doing in higher education and what has happened in COVID-19 times with students with disability. Now, higher education in South Africa and internationally is making progress with admissions and support of students with disability, but we still have a long way to go to ensure that persons with disabilities are represented in all programs in higher education and across professions. Now, as Marlene has said, how important it is for students to be supported and to be supported in many different ways in this time. When I asked about what support students were requiring at this point, our Disability Services Unit indicated that the greatest need was for psychosocial support, as students were feeling very anxious and stressed during this time for their own health needs, their finances, their family situations, and learning demands. So in addition to professional support that has been provided, there are also daily check-ins with students to ensure that they're coping. They have further been supported with computer programs to help them access learning materials, hard copies of learning materials where this is available, assistance with medical care and transport for students who are on campus, and where laptops have been needed, these have been provided. So student support is a critical aspect of disability inclusion. Our observation, however, is that this support is individualized and focuses mainly on students with disability. To build on this, we must extend our focus from individual support to ask, how can there be systemic change so that institutions of higher learning can become inclusive in themselves? Our signature project for Inclusive Practices Africa is a focus on how we educate our future workforce, all our students at universities, to become inclusive in their everyday jobs as teachers, doctors, lawyers, architects, artists, social workers, audiologists, engineers, scientists, accountants, among many others. This means that students will learn about inclusion as a key aspect of their work, so that disability inclusion will influence their practices. So how will we do this? And our view is that this kind of change must be embedded in the everyday activities of a university. So there are two ways. Firstly, to consider how we change curriculum, and secondly, supported education. Engagement in curriculum change will require a focus on inclusion. Curriculum includes all aspects of teaching, learning, assessment practices. And as Marlene and Charlotte have said, our focus on disability inclusion is intersectional. So while we focus on disability, we also focus on identities of race, gender, class, sexuality, and all that makes us human. Curriculum change of this nature requires critical and creative methodologies with a broad range of participants within and outside of the university. Our view is that if the graduate workforce thinks and acts inclusively, then they will influence their work environments to enable sustainable change. We are currently working with a student group in information systems who are working on a project that aims to make information systems like websites and information portals disability inclusive. I am inspired by the students because they are not just making technical changes, but they are questioning why are websites not accessible to persons with disability. The second part of our strategy is around supported education, which focuses on the development of coordinated student-informed mental health programs, given the current experience of mental health challenges in higher education. A healthy workforce contributes to societal health and well-being, and we feel that this approach, curriculum change together with supported education, can create an organization that learns how to be inclusive for everybody that is part of this organization. And we hope that higher education in general will play its role in contributing to an inclusive society. So I guess I'll leave it there and then we can continue the conversation.
Thank you, Harsha, for giving us those insights that really help us to understand how people's lives have been affected in the everyday through COVID-19, but also the call for systemic change rather than only focusing on individual experiences. So some of the questions that we have, I'd like to pose to you. Perhaps we can start with Harsha speaking, because I think this looks at some of the systems issues. And so the question is around, just give me a moment, that, you know, the need for, Marlene spoke about it as well, you know, the need for partnering between civic society and organizations, but actually looking at how the kinds of services that we offer can reach across different ages and also can actually reach communities where the services are needed. What are your views around how the gaps in having, I suppose, community accessible services in communities could be addressed, and particularly access to rehabilitation services when there is such an focus on acute care during the COVID-19 pandemic?
So I think the access to services in communities has to happen with a thinking or rethinking about what kind of service delivery are we going to have that is inclusive of all people and communities. Now, as you pointed out, our services are generally located much more at tertiary level and does not easily reach communities in terms of the current model. Part of the challenge we have is that the way our healthcare system is structured is that we don't have an integration of work that is happening between community health workers, therapists, and other people that work in community settings as an integrated part of community development. So I guess the one approach would be, importantly, to take a different view of how we approach health of communities by taking a community development approach, looking at what resources are available as a collective, and for all the different groupings to come together and create the resources and the actions that are necessary. The importance of people who work on the ground, like community health workers, community rehabilitation workers, peer supporters, parent facilitators, are all key. I think what we see right now is that each is doing an important part of the work, but that these services are not coordinated. And importantly, rehabilitation therapists have a critical role to play in being part of a team that offers an integrated service.
I would also like to respond, Rushan. At the moment, our community clinics it doesn't include at all persons with disabilities with the integrated approach, coming to go for a physio, speech therapist, or just to collecting even your epilim if you getting fits. So it's extremely important that we need to re-look at the model of our community clinics. At this particular stage, just being in a wheelchair getting spasms. There is the need that is out there is that at the moment it's much more worse. I'm just making us an example because we don't have access to a community physio at a clinic, and sometimes the clinic, it's a walking distance, but there is no physio, and that is what we are sitting with at this particular moment. Sometimes it's not that we don't have the resources, it's how are we going to stretch the resources to be inclusive. So community health workers are so important at this particular stage, and then we can connect that to all spheres of government, local government, which is of utmost importance, then it comes to provincial government, and then to national. But it needs to start on the ground in order for us to look at the integration. Now is the time to say, although COVID has revealed totally the inequalities that is existing, COVID also produces for us where we can re-look at our health systems. And I would like to pose the challenge to the universities where the curriculum that needs to cut across, how can I say, you can't, a medical doctor needs to have the elective about disability studies in that. The same needs to happen when you're a teacher, for instance. If we're looking at mainstreaming, and we're talking all the time of mainstreaming, the teachers are sometimes at a loss because in their particular training to be a teacher, no one speaks about awareness, or there's an elective to look at persons with disabilities. So it's a systemic change that we need to look at as per se.
Thank you. So this systemic change that, Marlene, that you're referring to, how do you suggest that we advocate for this kind of change? What are the funding processes? Because we've heard that the data is not necessarily available, the services are not there. What is the kind of processes that we need to put in place for this advocacy to be shifted towards implementation that you urged us to advance?
Political willpower. All of us that's in a situation where you are a leader, you first need to look at, as we talk about Black Lives Matters, persons with disabilities lives matters on all spheres of life. If we look at this morning, I had a meeting just for systemic change with the student funding body, which is NAFSAS, and they now have an annexure for funding for young people who wants to study at the university or any other tertiary education to apply. But again, they must go to a doctor to say that they're disabled. So I had an interaction with them and I said, how on earth are this young person going to get a taxi fare to go to the doctor? So we need to re-look at stuff. So what I'm saying with this example, wonderful for them with the interaction that I had with them last year, that we now have an annexure to say that the young adult with disabilities who coming to study has different needs than a student, another student. Lovely. But now don't put more obstacles now in the way to access that particular funding even more. So what are we saying now is that you need to unpack. You need to say to people, wonderful, but let's re-look now at the system once again on the accessibility of that particular form. So my appeal is for everybody that is in a powerful situation, whether it is the president, a politician, or an NGO or a lecturer, is to make that change in order to assist. It's sometimes not, you are so overwhelmed. That's why I said in the beginning, as a parent, because your challenges are so huge. To be if you are a person with a disability, it costs a lot of money just to stay alive. For me, just to be equal with you, I need to wear a brace, a caliper. That's costing a lot of money. So all of those things you need to be in taken into account. So all that I'm saying, to be a humane society, it's a collective effort. It is not just, the onus is not just on persons with disability to drive this agenda. It is a collective societal agenda that we need to drive.
If I can just add to that.
Sure.
I absolutely agree with Marlene. It's every single one of us has a part to play in it. So it doesn't matter who you are or where you are, you can make a difference relative to disability inclusion. And I think that for me, you know, we talk a lot about government, we talk a lot about communities, but we equally must look at private sector and the corporate sector,
Yes.
in particular, who must be part of the change process. And I think if we have a society that is this has this level of inequality, then it is important that everybody comes together to look at how we address these issues that are long-standing, that are historical, and that poor communities on their own cannot resolve, that it is going to take political will, it's going to take great leadership at every single level. So every single organization should look at how it improves on its inclusivity consciousness, how it drives strategies for change, how we actually make differences to people's lives in our organization, whether they're students or workers, whether they're patients in a health system, etc. Because if we don't have this kind of leadership, then I think, again, the burden of this responsibility will be on persons with disability to do it by themselves. And this particular, at this point in our time, we know that that's not possible because the problem is big, but it includes people who have ideas about how else we could change society, not just on the basis of disability, but race, gender, sexuality as well. So there are many different organizations, partnerships that can come together to create an inclusive society. And I think to encourage everybody to be part of that change.
I just want to come in here because it's so important. It's the economics as well. Persons with disabilities are always been seen as interns. You can have a PhD or a master's, but you never get employed. And this is, and I think people, our young people that's listening and people with disabilities, it mustn't be a scarcity. I'm a woman with a disability in a leadership position. It mustn't be one out of a million that's having that particular achievement. It should be the norm. And we need to start to say that we do have a charter. We need to look at that the disability needs to be, that it must be on the Parliament's agenda, that we need to look at that policy very in sync economically, and also to look at the Bill of Rights as per se, the planning that is happening, planning commission, but it's about jobs at the end. Before COVID-19, persons with disability was not employed. Again now with COVID-19, we're without employment, and even after that. So if we're not going to address this, the systemic changes that we foresee is not going to happen. And it can't just be that persons with disabilities are only going to be seen as to be interns and interns for the rest of their lives, just as a tick box. They should lead and they should have a job.
If I can maybe just add to that, for the for our employment to happen, we often think of it at the point at which people seek employment. But if we think about how persons with disability actually are at a disadvantage from the time they're very young, in that they don't have access to early intervention, don't have quality basic education, all of this adds to the unemployment crisis that we're facing. So it is really important that we strengthen every system. So we can't think about employment without thinking about basic early intervention,
Yes.
early childhood development, basic education and employment, all as part of one system that would advantage somebody in a system or give equal opportunities to all people.
Thank you, Arsha and Marlene. So thank you for that input. Some of the questions that have come through are taking us back to some of the points that Charlotte also raised around accessible information and accessible services, which you've both also spoken to. But what you've added is also for us to think about inclusive systems and to really have people engaging in occupations in the broad sense of where occupations refers to participation in work, in school, for students in tertiary education and so on. So with that in mind, one of the questions that's come from the audience is when there are particular examples such as or innovations such as telehealth that could be made available, how should those then be incorporated into more systemic responses, or is a solution like that within health, although the kinds of solution that we could have across sectors? What are your thoughts? Arsha, maybe if I can start with you, and we've only got 3 minutes left, so I'm going to ask you to respond to the question and any last take-home message, please.
So,
Arsha will start and then Marlene.
I think it's important that we use all of our resources and platforms for service delivery. But I also want to just guard against us taking this approach and still continuing a system of inequality. So when we do this, any intervention, will it help us to reduce inequality? And that for me is a more fundamental question that we need to ask, because we can do activities without thinking about the impact on what the long-term goal is. So for me, always think about the long term and think about how we reduce inequality.
Roshan, for me in particular is that we mustn't park disability in units. It should be an agenda across sectors. It should not just be like an example that all the universities will say, but we do have a disability units. That is not the solution to look at the system as per se for change. And that's also on the school level, it's also on the economic level, and it's also, you can have an official that can look after persons with disabilities at a workplace, but then you don't employ persons with disabilities. So in that way, I would like to say there should be active relook, and really change must be active and not just be sitting on the desk of people by saying we have the policy, it's a tick box, it's about changing lives, and we're starting with really from the bottom of equality, and equity goes hand in hand.
So if I can add one more point, I think for me, something that I learned long ago through a conversation with Vic Finkelstein, who was a disability activist in the apartheid era time. And he said that we should really think about an African response to disability inclusion, because what we've learned from the West is that we can have independence, but actually what has come of that is that many disabled people still feel isolated, and that given our culture of human connection, we can do a lot better. And I think Africa can definitely find more creative ways of enhancing disability inclusion.
Great.
Okay, so thank you so much for those profound words. An African way of having disability inclusion and promoting the active change that Marlene, that you're referring to, and keeping in mind the long-term inequalities that we face, so that we don't take a siloed approach to disability inclusion, has just been some of the messages that has really come across, and I think really opened up the conversation. I'm hoping that after today's webinar, there'll be more discussion and thinking around how to promote and advance a more systemic and disability inclusive way of responding during COVID-19, but also to the longer term social inequality, which we're ultimately wanting to eradicate. Thank you everyone for joining us today.
You.
And thank you so much to the panelists.